Okay, so did I miss one? Yes, so collaborative treatment for PAD, we're looking at peripheral arterial disease. So we're going to do pharmacological treatments. We're going to slow atherosclerosis down, and we'll do surgery. So pharmacological, whatever we need to help us with what? Diabetes, hypertension, what can help us with pain, with paresthesia, all of those things. Slow atherosclerosis, which would be what? Lifestyle changes, exercise, right? Medication with the lipidemias, like with the statins, and surgery if we know already that someone has over 70% occlusion in an artery or somewhere. We're going to make a bypass or stenting, right? We can do those things. Okay. Now treatment for CVA, symptom relief. So we're telling them, let's see, I remembered it this quarter. So someone showed me. So this for venous and then this for artery. So for arterial, we want our legs to be dangling, right? And for venous, we want our legs to be up. So dangling makes sense because we want the blood to get to the extremity because it's not doing it by itself. Gravity is not enough, so we need to help it with gravity, right? I mean, the arteries are not doing their job, so we need to help it with gravity. And then the valve, right? So symptom relief, we want to lift our legs up to help the blood flow back to the heart. So we would elevate extremity, promote circulation. How would we promote circulation? Tell them to move. Yes, we're telling them to move, do passive exercises, right? Promote circulation, right? Now, we promote skin integrity and healing. How do we promote skin integrity? Diet, yes, we can do that. What else? Reposition.
Tell them to move.
Moving. Reposition, moving, dieting. Yes, definitely. That's a great one. We want to tell them to check their feet every time because they are not going to feel if they have anything because of the sensations. We're also telling them, you know, what else? Maybe if they already have a wound, we already mentioned the eating, but also staying hydrated, maybe barrier creams, that kind of thing to kind of prevent any other problems. Maybe if they're bedridden, we might want to give them some cushion, pillow, or foam or something to kind of put their legs on so they don't have ulcers. Compression stockings, what's that going to do for us? Yes, right? So the problem is the valve can't close tight by itself. It's kind of lax and it lets blood go back. And as you know, those TED stockings and compression devices, they squeeze it tight. And it's so hard to put on because it's so tight. And what it does is once it's on, it just holds it tight. And then the blood, once it pushes through, it goes through, but then it collapses right back the way it's supposed to, right? So that's why we do compression stockings. And we do them, right before surgery. We do them on pregnant women because we know the possibility of blood just sitting there and the valve's not working properly. And definitely exercise, okay? So let's see. Stockings, okay. All right. So patient problems. What problems are we going to have with people with PAD or PVD? We're going to have poor blood circulation to peripherals. How do we identify that? What would be our assessment that would tell us that? Pulses, yes. What did you say? Cap refill. Those are our two main ones. What else could we see? Pallor, right? Or the extreme.
Edema.
We could say edema, yes, but of color. Cyanosis, right? Or it could be the other one when it's really, really good and you're like, oh, wow, but it's like, that looks too good. Like redness, right? We could see redness, we could see pallor, we could see, so these are the things that's gonna tell us, right? So with the person with Raynaud's, right, we will see that red flushed fingers, like it looks so bad. And then we'll also see the really, really light, and sometimes it's not all the fingers. Sometimes it could be just 2 fingers. or very tips of the fingers, but it's so visible that you can tell. Okay, so that's how we'll be able to see poor blood flow. But what else? What's another thing that would tell us other than pulses? Blood pressure, right? Blood pressure. Yeah. What else? Acute pain. How do we identify acute pain? Usually they'll tell us. What else? What if they can't speak?
Hesitancy to like move.
Yeah, they don't.
Guarding.
Yes, right? Like we tell them, oh, you need to exercise. Can you go? And they're like, no, I don't. I'm in pain. Like they'll tell you they don't want to move. They don't want to exercise. They don't want to go to therapy, right? And then you have to ask them why. And it's not just because they don't want to. Sometimes they're in pain, right? So what will we do to help them with this? Medication, right? We can do medication, we could do imagery, we can do other things that are non-invasive and invasive to help. Or depending on which one it is, we can tell them what we do. We could elevate, we could depend, right? Depending on what we need to do. So acute pain. Oh, what would we have done for the poor perfusion? What do we do with the poor perfusion? How do we help that problem?
Encourage moving.
The movement, yes.
Elevation or
dependence, yep. Medication, right? How about skin breakdown? How would we be able to tell? What would we see that would tell us they have skin breakdown?
redness.
Okay. And not just redness, but what? Non-blanchable, right? So it'll start. Yeah, it'll start blanch. Sometimes it'll blanch, and then it'll go to non-blanch, and then it's and then blanch is when it becomes white, right? So it's red and flush, and then when you put your finger on it and let it go, there'll be a white spot because the blood diffused, it went away. But when it's non-blanchable, you put your finger there, you lift it, it's still red, same red. That means it's stage 1 already.
I feel like I should have.
Yes.
So you said for the CVI, so we medicate them in order for them to ambulate? Like,
If they had pain,
Mhm.
if they had pain, yeah.
What would you normally give us for
So it could be just Tylenol. Just, sometimes if they have just generalized pain, it's just some Tylenol. That would ease some of their pain.
Would I don't know if this is like a dumb question, but would ibuprofen work as an anti-inflammatory?
It can definitely work. Yes, it will.
Would it reduce a little that swelling?
Yeah, it will. It will. Yes. Yes. So poor ambulation. Okay, so now with the poor ambulation, we would encourage them to walk. It would be just, we'll start slow and then we'll progress, right? Oh, I'm hearing your little comment, your comments on the side. So it's okay. It's okay. When we studied mobility and movement and like stage 1, stage 2, stage 3, do you remember? Did you guys study stages of wounds? Yeah, that's when we learned about the blanchable.
Definitely, it's just I feel like I was kind of repeating words. I was just like, blanchable.
Yeah. No, that's good. You guys, honestly, that's what I want you to do. No question is a dumb question, right? Especially with something that's new. You need to hear it so many times before it sticks. It's a foreign language, right? Like if you were learning Spanish. Oh, sorry, you already know Spanish.
No, I
if
don't.
you were learning, oh, you know? Oh, there we have it. Sorry, I thought you did. If you were learning a different language, right, you would have to hear it multiple times, and sometimes you'll forget. So nursing, medicine, it's a whole new jargon. So don't feel ashamed. Like even me sometimes when they use like the abbreviations, I'm like, what does that abbreviation mean again? I hate abbreviations for that reason because I don't remember. And so I have to kind of remind myself. We all do it, so no worries. Okay. Poor ambulation, we're telling them to walk. We're helping them to feel motivated to do so. Fall risk. What's the fall risk for? They have pain. Yep. They can't feel. Yes, they don't know when they reach the ground or not sometimes, right? They're like, am I there? Am I there? So we want them, and they have pain. And sometimes, when you're in pain and you have to stop and sit, are you going to sometimes be very careful where you're landing, you're behind, right? You just want to get off your feet, right? And so that's a thing as well. So definitely fall risk. Impaired feeling to the feet, right? So what do we do about that, the impaired feelings to the feet?
We do have to have them inspect their feet.
Yes, you want to make sure they look at their feet, check for any wounds, any cuts. What else?
Don't use electrical
Yes, don't use heating pad because you might not feel how warm it gets. So connected to the heating pad, also hot water, right? And so do we need to check the hot water before they use it? And where would you check it with your hand? Even though you're like, well, extremity for extremity, but which one is closer? The hands. So they will have more feeling in their fingers than they will have in their toes, so you can. So sometimes we tell them check with your elbows, but if they check with their hands and they can feel it, that's fine too, right? So definitely check the water to make sure it's tepid in order to use it, right? And then we tell them, the same kind of treatment about diabetes, really. It's the same thing they're using here. Because usually it's diabetes that causes this for many people. Let's do some questions. Do you have these questions, by the way? Dang it. Okay, so let's explain the questions then. Okay, the question. The RN charge nurse on a vascular unit is working with a new unit secretary. Which statement concerning laboratory data is most important for the charge nurse to tell the unit secretary? So we know it's number. Nope.
What?
Who said what? Who said it? 1. It's number 1. So number 1, be sure to inform me of any lab information that is called in the unit. And the reason why that is if it's being called, that means they felt it necessary, like it's an emergency. Like, if you just fax something, it's like, oh, if they get it, they get it. If they don't, they don't. But when you call, it's because you feel like it's urgent. That's usually the logic they use, right? Like working in the facilities, like rehab and hospital, like if I get a call, they want to make sure who they spoke to because it needs to be on record that someone received that information, right? So because laboratory values called into a unit usually includes critical values, the charge nurse should tell the unit secretary to inform me of any laboratory information that is called. Okay, then we have the nurse on the vascular unit is caring for a client diagnosed with peripheral arterial occlusion disease. What statement by the client warrants immediate intervention by the nurse? Someone says 2, yes. So my legs are so cold, I had to put a heating pad on them. And we just said we shouldn't put heating pads because they may not feel how hot it gets, right? So this comment warrants immediate intervention because the client's legs have decreased sensation secondary to arterial occlusion disease, and a heating pad could burn the client's legs without the client realizing it. Here's another question. The male client diagnosed with peripheral vascular disease tell the nurse, I know my foot is really bad. My doctor told me I don't have any choices and I must have an amputation, but I don't want to. Which action supports the nurse being a client's advocate? Say it one more time.
3?
No. 4. Tell the client she will go with him to discuss his decisions with the doctor, right? So the action shows the nurse being the client's advocate, offering to go talk to the HCP about the amputation and making sure the HCP hears the client's opinion is being a client advocate. Another discussion may change a client's decision, but either way, client advocacy is supporting the client's decision. Last one. The nurse just received the AM shift report. Which client should the nurse assess first? 1, yes. The client.
Read the other one.
The client who is 6 hours post-op, vein ligation, who has absent. Yeah, that's a big one, right? Absent pedal pulses. We're about to amputate that leg soon. So we don't want our pulses to be absent because no pulse, no blood, no life. Right? So the client is experiencing neurovascular compromise and requires immediate attention. The client diagnosed with venous problems should have palpable pedal pulses. This procedure is for clients diagnosed with venous veins.